Let's just focus on to this development and tell you about the COVID-19 pandemic gripping the world. No doubt, as you already know, healthcare professionals were concerned that other treatable diseases would be neglected as communities grappled with lockdowns. 2 years later, the consequences are starting to be seen. A joint statement by the United Nations International Children's Emergency Fund and the World Health Organization has revealed the starkest decline, in childhood vaccinations in, get this, 30 years. For more on this, we're joined by Lika van der Veel, UNICEF's Deputy Regional Director for Eastern and Southern Africa. Thank you very much for availing yourself this afternoon. This is quite a startling revelation in terms of this is the worst that we've seen in 30 years. How did we come to that conclusion? What did the data show?
Thank you for having me and paying attention to this important issue. So data has shown that even in 2021, the vaccines and immunization, routine immunization, has not bounced back from 2020, where we saw a stark decline because of the COVID lockdowns, the COVID measurements, and other impacts. And we had hoped that actually in 2021, with the campaigns and with the closure less, that we would be able to reach more children with the routine immunization. And data has shown that unfortunately, instead of bouncing back, we actually made it worse. And more children have not been vaccinated for the routine vaccines. And in fact, like you said, it's the first time a decline in 30 years, which means that we're more or less back to 10 years ago in terms of children covered by routine immunizations, which are really protecting them for the fatal disease, the childhood illnesses.
What are these vaccines that the little ones have missed out on?
Well, of course, the DTP3 is one of the biggest marker. So these are 3 doses, and infants get them very early on, and they really protect very well. And those doses have not been reached all the children. The third doses, we really have seen an increase to 11.5 million children in our sub-Saharan Africa region. Worse, because those children at least have the first and the second doses. Worse, the 0-dose children, so the children that even haven't started the 3 rounds, they are up to 8 million. And that, of course, very worrying, because that means that those children are not at all protected to those dangerous diseases. The other one is measles. As you know, measles is also quite fatal and dangerous. And young children need to have the measles vaccine to be well protected. And also there we have seen a stark decline of like 3%, which means that depending on the country, 30% of our children are not protected, and sometimes even up to 60% in the worst case scenarios. So these 2 are big markers that show us that the routine immunization has not bounced back. In fact, it has gotten worse.
You also add that the consequences will be measured in lives, but there were some countries that held off declines, Uganda being one of them.
That they held off declines. Yeah, so we have a couple of countries that have been trying to do a couple of campaigns, having bounce back campaigns, door-to-door campaigns, and making sure that the families would be able to reach the primary health care, the routine services. And I would say many of the countries really have tried to have a continuation of services for young children and their family. But this was difficult, not only because of these measures of lack of transport and mobility, but also because there was a diversion into COVID response, including COVID vaccine outroll, both from national government, but also from donors. And then, of course, the issue about vaccine in general became more of a public health debate, and that also has had an impact on being able to reach the children and their families that really need to be covered.
What about parents who are hesitant to vaccinate their children?
Yeah, so the hesitance was there a little bit before COVID, but frankly, normally if you had good communication with the parents, the healthcare unit would follow up after, after delivery. They would make sure that the mothers would take their children to the healthcare centers. Then the hesitance was sort of countered by good information sharing, personal follow-up, explaining what kind of side effects could there be for the children, and really engaging in a dialogue. And in that way, the hesitance was getting less and less. And the hesitance was never really the biggest problem that we saw in covering children with illness immunization for young children. Having said that, of course, the COVID discussion has increased some of the hesitance across not only childhood illnesses or COVID, but just a discussion. And there, good information needs to happen. We need to make sure that parents are able to discuss with the health workers, with themselves, with the community leaders. And like that, we can explain to them that actually it's much more harmful not to vaccinate your children, and that the vaccines that have been out for the last 30 years are really safe and are really there at the best interest of the children.
In your statement, you speak of monumental efforts will be required to reach universal levels of coverage to prevent outbreaks. What are these monumental efforts?
Yeah, so what we saw was a disruption in routine immunization, routine services in general. And again, not surprising because, of course, not only our health workers had to divert their attention to the COVID cases, and also once the rollout of the COVID vaccine happened, they were also involved there. So what we need to do is that the resources are going back to the routine immunization, going back to the primary health services where most of the parents go for the vaccination of their children, and also to make sure that we are accelerating, so we're catching up. And that by definition means if you have lost out, you need to invest much more to catch up and accelerate. Also, don't forget that in fact our population in the sub-Saharan continent is growing. So in fact every year we need to cover more children in terms of numbers. And that, by definition, needs then an increased investment. So, yes, it's monumental. It's all hands on deck. And we really need to make sure that the children don't suffer the most of the COVID pandemic, which in principle is not necessarily a children's dynamic directly, but indirectly, they're very badly affected.
Thank you very much for availing yourself this afternoon. Lieke van der Wiel, Deputy Regional Director, Eastern and Southern Africa Regional Office of UNICEF.